As a parent of kids in youth sports, I've seen firsthand how poor coaching, overcompeting, and negative sidelines can crush a kid's love for sports. That's why I recommend KLC Method Basketball. Coach Cam focuses on fundamentals, confidence, and true player development. No politics, no favorites, just real growth. If you have a K through 12th grader who wants to start or level up their game, give Coach Cam a call. KLC Method Basketball, where kids learn, grow, and fall in love with the game. Get started with Cam by clicking the link below. On Into the Mindset, we are all about protecting what matters most. And that includes your safety and your time. Fall is just around the corner, and with it comes leaves, clogged gutters, and dangerous ladder climbs. Freedom Gutter Covers gives you a lifetime no-clog guarantee, so you'll never have to risk a fall or clean your gutters again. Let us install your covers today so you can focus less on chores and more on faith, family, and freedom to be a healthier you. Click the link below to get a free quote today. And don't forget, type in Into the Mindset to get 5% off. Welcome to Limitless Living Into the Mindset, the podcast that dives into the heart of growth, grit, and what it really means to keep moving forward. Ryan, thank you very much for being on the show. Yeah. You are our first guest that you're kind of our specialist. You're our expert.
Listen, don't speak too highly. Yeah,
I knew exactly what you were going to say whenever I mentioned that too.
Sure.
But I'm really excited to kind of start this next phase of the podcast. We are a health and wellness podcast. I think there's a lot that we can learn just from the lives that people have lived.
Yeah.
And I want to keep highlighting that, but I also want to make sure we're bringing in people that have knowledge about some of the things we're talking about.
Yeah.
And the knowledge that you have on our topic today, which is a huge topic right now with GLP-1s and hormone therapy and peptide therapy. I'm really excited as an athlete with the peptide therapy side of it. So I feel like it's going to be a great conversation.
Yeah, I'm excited to be here. Thanks for having me, first of all. And certainly, again, we're going to barely scratch the surface on what can be, and a topic that is more in depth than, what you can probably even think about, honestly.
Yeah. Just with some of the questions that I was getting from people online and diving deeper into it myself, it's a giant, vast world of information that, again, I even think science is just scratching the surface right now on it.
Right.
With a lot of it. And so as much as we know about it now, there's a lot of unknowns as well.
Truly.
But before we dive into that, I want to tell us a little bit about you, a little bit about your family, and how you kind of got to where you are right now with your private practice.
We, my wife and I, Kaylee, we started a functional medicine clinic here in town. We started that, it's probably coming up on 2 years now. And it was basically birthed out of our own health journeys. I think when I came back from my last deployment, I had done really well on the deployment because there's nothing else to do besides work out, right? So it was easy for me to slim down and kind of get in shape. And when I got back, you fall back into the same cycles, right? And it's hard to kind of maintain those things. And so as I've gone through my own health journey, I think when I came back, I was like 240 pounds. And so as time progressed and as I kind of dove into the medicines, the peptides, the GLPs, kind of found myself using it myself, then also prescribing things like this to family and friends, and saw results that were just absolutely incredible. And thought as we were sitting in bed one day, why aren't we doing this for our community? Why aren't we doing this for, more than just family and friends? And that's how Optimized Health kind of got started. And beyond that, I've been in practice now for almost, 15 years. And the amount of good help that I've done just in that time span, this 2-year time span, has been completely incredible. Like changing lives and just people coming, to me after an injury and seeing them and kind of making some recommendations and then watching them just not only get better, but better beyond what they were before they even got injured.
Right. And I think that's the magic that these medicines and the therapies are bringing to light.
Yeah.
It's just kind of one of those things. Why did it take this long?
Well, and again, we're scratching the surface. Like we have access to these medicines, and then you bring in peptides, like truly these peptides that you've kind of seen online, on TikTok, on Instagram, and then you throw those things into it. And, we make like 300,000 different peptides on a day-to-day basis, right? Yeah. And we have access to maybe 1,000 of those.
I heard that number just a few days ago, and I'm like, you got to be kidding me. That's insane.
It's incredible. And that happens daily, right?
And it's not just like you said, we're scratching the surface. So whenever I look at peptides, I've heard it as far as, professional athletes using them for recovery and things like that. But I mean, we're talking a vast amount of things that these can help.
Oh,
we have and everything.
Well, truly. And, anecdotal evidence that I've seen and have personally kind of experienced, then you kind of go into the research and you go into the data and the animal studies. And there are things that are happening with peptide therapy that would absolutely blow your mind. Well,
I want to get into that side of it, but I want to start with kind of probably the two biggest, topics with this, which is the GLPs and the hormone replacement therapy.
Yeah.
So let's start off with the GLPs. What's a GLP?
So GLP stands for glucagon-like peptide. And let me kind of back up a little bit. So what is the definition of a peptide? The peptides, the FDA kind of defines these things as small chains of amino acids, which is the building block for all proteins, right? But 40 amino acids or less, that's defined as a peptide. 41 and greater, that's a protein. GLPs obviously are big in terms of in the media and in the news and what you see on a day-to-day basis. But for instance, oxytocin, I'm sure everybody has heard of oxytocin. That's a peptide. Insulin is a peptide. So we have, access or we to make peptides all the time. It's the ones that now are becoming so popular that has brought, I think, peptide therapy into sort of like mainstay or mainstream media, et cetera. So glucagon-like peptide, we make this in our gut, right? But as we age, most of the time, these peptides kind of fall off the table. We don't do a good job of like maintaining high enough concentrations of these peptides to sort of do any sort of good. And so things like GLP-1 receptor agonists, your semaglutide, your tirzepatide, these things, we initially made them for diabetics, right? So to help with insulin sensitivity, which is completely different than what treatments we had prior to this. For instance, like metformin, that doesn't help with insulin sensitivity and glucose uptake into the muscle or into the cell. And so whenever these medications were first formed, it was for diabetics. But as we now know, and the story goes, as we started giving these peptides to diabetics, we saw different things happen, like, for instance, the weight loss, right? And then the FDA kind of seen this, and the pharmaceutical companies saw this, and they're like, oh, my gosh, this is something huge. And then it just, it blew up. Yeah. It blew up.
It did. So getting into the GLP, and I want to, like, peptides for our body naturally has these already in it. Correct. We're just boosting them.
Exactly. I mean, right. Like I said, they kind of fall off the table. So when you are introducing a peptide, be it GLP or any other peptide, you're basically promoting a signaling response in either the mitochondria, or even sometimes these peptides are so small that they can kind of wiggle through and get into the nucleus of the cell and act upon DNA. So as we give ourselves or administer peptides, these are all things that we naturally make, and which is why the names are sometimes so crazy and weird, and it's all just acronyms and numbers.
Which I feel like is a huge step as far as preventative medicine goes over the reactive that we seem to have been living with for the last few years.
Yeah, and I think, I guess if you could maybe think about good things that maybe have happened because of, for instance, COVID. It kind of brought an individual's like desire to want to take care of themselves and take onus to their own healthcare, because there was a lot of mistrust. There was a lot of bad information going around. So people began to sort of look into these things a little bit more, or at least, from a personal standpoint or from a human standpoint. And then they found these things as sort of a product that could potentially help them for not only longevity, but immune responses.
Right.
And for, again, weight loss and for other sort of properties that these peptides can promote.
Yeah, I think you mentioned longevity, which is a word that, it's been around. We've had it, but you haven't heard it except for the last few years. And now you see a lot of doctors on podcasts, and you see a lot of the bro science stuff where that's what they're talking about is longevity of it. And this is how we could do it. I mean, there's books on it and everything, but it's kind of came to light a lot more within the last couple of years. And maybe that has something to do with COVID as well, and people just wanting to try to take care of themselves.
Well, and I think one of the things that I sort of think about too is that a lot of times people kind of compare themselves to other people, right? So for instance, Jeff Bezos is a billionaire, right? I'm never going to get to that sort of status, but what's his VO2 max versus what's my VO2 max? Yeah. Right. And what is his, chronological age versus his, biological age? Like, is he aging slower than what I'm aging? Those things you can kind of compare and kind of give yourself a good look at what you are compared to everybody else. And those are things that are easily, I wear a Whoop. That's something that you can see on a community standpoint and like compare yourself and be like, man, I'm doing pretty good. Yeah,
definitely. I want to get into, with all of this, a lot of questions. Yeah. And you kind of mentioned as well, there's a lot of stuff in the media and things like that. And we don't know what's true anymore. So I had put out there online that we were going to have you coming in, and any and every question that people have, I want them to send it in. Sure. We probably won't get to all of them, although we could talk about this. We were just joking. We could talk about this all day, all night. I mean, this is a vast conversation that can go forever. But I'm going to try to get to as many of them as I can. Sure. But let's just start off with the GLPs. Do we know that this is safe long-term?
It's so people probably don't realize, but we've got 20 years of data already at this point. Not only do we have the data, but we have studied these peptides specifically in a population of people who arguably are probably amongst the sickest, these diabetics, right? So as a result of the data and as a result of the literature, we are now thinking and using GLPs for different scenarios as far as like health maintenance that go beyond, insulin sensitivity or weight loss. We're now seeing benefits from a cardiovascular standpoint, right? So I think the FDA has approved these GLPs for use for cardiovascular disease and renal protection and kidney disease. I use them personally in the GI clinic because for fatty liver disease. And so we're seeing so many benefits associated with these GLPs that go beyond what you see in the limelight and see in the media. And I think as time progresses, there's more GLPs coming down the pipe, and they're combining them with other peptides to sort of help promote and help deregulate some of the side effects that are associated with them. So, reticulotride, I don't know when that's going to be out on the market, but you kind of probably heard it as Retta on social media. But I think the literature says that in terms of fatty liver disease, because that's kind of the space that I'm in, is that a reduction in fatty liver disease and even more so fibrosis, which is scar tissue of the liver when the hepatocytes kind of start to go haywire and don't clean themselves out, but we're seeing like a 30% reduction in fatty liver disease in a course of time that is unimaginable. When we were talking about the mainstay treatment for that 15, 20 years ago was Mediterranean diet and exercise.
Yeah. Which is, that's when I'll have somebody, a client or somebody like that come up to me like, I want to diet. What should I do? And of course there's so many fad diets out there and everything. I'm like, listen, Mediterranean diet, like it's been around forever. It's great. But like you said, it's not a cure all. It's not a fix all, especially when you have something more physiologically going on.
Correct.
And everything like that. And I also want to remind everybody that, a lot of questions, this question came up a lot of, is this safe? Is it safe?
Yeah.
And like you said, these are all things that our body already produces.
Correct.
So when we're comparing it to antibiotics and other medicines, I mean, that's a, chemical, synthetic,
right.
These are things that are already in our bodies that you're just boosting.
Correct. And
so
now,
if anything, it might be safer.
True. And I mean, my gosh, you sort of see the side effects of some of these medications, like, headaches, blurred vision, cancer, erectile dysfunction, so, I mean, the list can go on and on in terms of side effects for medications. But when we're signaling a pathway that already exists in the human body, in the metabolic health of things, when we're signaling those pathways and an increasing efficiency for mitochondria, the side effect profile for most of these peptides are very, very low. I will say, just in terms of the GLPs, we have seen some things that certainly, preclude you from being able to take them. And the medullary thyroid cancers, the multiple endocrine neoplasia type 2, those sorts of things, like that's why it's important that you kind of work with a healthcare provider that knows your health history, that knows your medication history, so that, whenever you are getting these things and using these things, you want to make sure that you've got some guidance so that you don't overdo it. Because just like anything else, I mean, you can overdo it with Benadryl, you can overdo it with aspirin. So you want to make sure that you've got some guidance as far as the safety of these things.
So that kind of leads me into one of our other questions when we're talking about, gray market or like the cheap online, or going cheaper online to get. So go into a little bit about your process. So if you have somebody come in that's interested in this, what's your process to get them onto a GLP and everything like that?
So I personally am very lab heavy, right? So what do I mean by that? Well, I'm getting labs. I'm looking at biomarkers. I'm looking at different things that can sort of point me in the direction that, hey, maybe this is a good fit for this patient. But it's all individualized. So, for instance, with the GLPs, is this person, insulin resistant, but yet not diabetic? Or does this person have, normal thyroid labs, but again, we're checking antibodies for like thyroid peroxidase. And certainly we're seeing that maybe they've got some evidence of Hashimoto's. So, the evidence is out there that these things help with so much. And you can kind of maybe chalk this up, or sort of the big umbrella picture is like inflammation, right? So if we can lower inflammation in these disease processes, then we can sort of establish and kind of reverse some things that the disease process is doing to the patient specifically. But personally, I'm very lab heavy. I listen to their history. I, do a physical exam and am very cognizant that, again, these medicines are not for everyone. So starting slow and moving through the process to make sure that they're doing well while on the medication, and also noting side effects that sort of come about as they are on the medications, and then adjusting fire sort of as they move through this evolution.
So you kind of mentioned a little bit about it right there, but once they start the medication, is it, all right, you're in here, let's just give you everything we have and go from there? Or are you is it a building block kind of system? It
is a building block sort of system. It's again, tailoring the dose, tailoring the way that we administer this, geared toward very specific things that the patient is sort of, complaining about or coming to us about. And making sure that, again, as they move through the process, they're not just out there by themselves, not knowing what to do next or what the next step will be, and being able to guide them through any adjustments, either up or down, that they may require as they kind of move through the process.
Yeah. And I wanted to touch on all that because I feel like it's extremely important, especially with the gray market kind of area where people are able to get these things and administer themselves and stuff like that. Not really knowing exactly what is happening with your body and how dangerous that could be.
True. And I mean, I've seen it, personally, is that patients will come in and have gotten these things on the black market or have went to the gym bro and gotten growth hormone, secretagogues, things like this. And then come to me and like, man, I think I messed up. And then the knowing how to course correct once they come in, talking about these things, because, that's the other thing is that you can mess yourself up on these things pretty quickly if you don't know what you're doing or you don't have the guidance. So getting them on that black market, gray market sort of area, we use a lot of compounding pharmacies, and compounding pharmacies are a little bit different than, say, pharmacies that you're not seeing a provider for, or pharmacies or programs that you're not seeing providers for, that you are just ordering it and then they're sending you syringes and a vial of medicine that has some powder in it, and how much do I reconstitute this powder into, and what's the concentration once I get it reconstituted, what's my dose? All those things sort of go into it because, for instance, when you start off on a GLP, the progression, you start very low concentration and then you move yourself up pretty quickly. If someone who is naive to these medicines and don't know the concentration and give themselves what is, considered to be the higher concentration, oh my gosh, you can develop bowel wall thickening, you can develop gastroparesis, which are reversible, but it's going to put you in the hospital.
Yeah,
like it's going to make you sick. It does
not feel good.
No, it's going to make you sick. It'll make you sick.
Yeah, not at all. So when somebody does get started on them and they've kind of reached that level, what happens if they stop, or should they stop at a certain point? Or kind of what's the protocol of, if it's for weight loss or anything like that, okay, we've reached a goal weight. Now what do we do?
Right. And what I always tell my patients is that these medicines, peptides, GLPs, are the tool, right? There is nothing that's going to, there is no magic bullet. You have to make the lifestyle change. You have to make the hard choices to change your attitude about food, change your attitude about activity, because that's the sustainable thing. When any other diet medications, any other, weight loss, et cetera, for example, if you don't fix what got you there in the first place, then when you come off these medicines, you're going to gain it all right back. And the studies show that probably even more so than where you were before you started.
So somebody who starts a GLP for weight loss while also starting walking, getting in the gym, creating a healthier lifestyle, fixing their nutrition, they can eventually work off of the GLP and live a healthy life without
Absolutely, 100%. And then, there are other sort of natural things that you can do to help increase your own GLPs. So, but yeah, I mean, these things, I think the way that I explain it to people is that it helps raise the tide so you can get the boat in the water, right? Because you know this and I know this, but when you are seeing results, it's easier to maintain the good habits. It's when people, don't feel good. It's when people, don't like the person looking back at them in the mirror. When they're like, you know what, this is not worth it. I want bread,
Yeah. And I mean, I can fully understand that. I mean, somebody who my whole life has been, running and within the health and wellness realm. And, these past few months I've been injured. I haven't been able to run as much as I like to and things. And even, even myself, I'm like,
Yeah. Oh, it's easy. It's
and
easy.
you have to kind of self-motivate back up to get back out there.
I think, a lot of people, when you start seeing those results, when you start seeing those changes in the mirror and how your clothes fit and just overall feeling better, it's way easier to kind of stick to the program.
Yeah, kind of light that fire.
Yeah, because it helps motivate you to make the harder choices because you are wanting to do better and eventually, hopefully thinking, hey, I'm going to come off these medicines. So I've got to make sure that I do the right thing so that, again, that becomes the sustainable thing so that I'm not in 2 years worse off or back to where I started. I
think that's really important for people to understand when we hear the terms magic drug or magic pill or, the things like that is it feels like it is, yes, but the idea is that you're not doing this the rest of your life. No. So you have to be ready to make those life changes and things like that. So I really want to shine a light on that is you can't just do the drug and expect everything to be perfect. At some point, you're going to have to embrace a different lifestyle.
I heard somebody say it once and I kind of use it myself, but I mean, there's no pill, there's no potion, there's no injection that outdoes bad decisions.
Yeah.
Right. So you've got to make the good behavior, the good choices, to make sure that you're, again, having this sustainable lifestyle that, becomes the thing that you then now can focus on, as opposed to like, oh my gosh, it's whatever. I got to take my shot. And so again, you got to make the good choices.
So when we hear GLP, it's talked a lot more amongst women and within kind of the female a little bit more. But can men benefit from GLP?
Yeah, absolutely.
Even if they don't seem overweight or if they're having, like you were mentioning, fatty liver disease, things like that.
Yeah.
Can men get the same benefits as women are getting?
Yeah.
Have they used this for men that also have diabetes?
Absolutely. Yeah. I think these medications, these peptides are not gender specific. And they've kind of done some research. They've done some studies that compared men and women. Men typically do better on these medications for insulin resistance.
Which is just going to get the eye roll.
I know, right.
Because we get flack all the time for, you
Quit
stop drinking soda. Yeah.
I hear it every day. You stop drinking soda, or he stopped drinking soda and he lost 10 pounds. I've been in the gym for an hour a day for the past year and a half and I haven't lost a pound.
We are genuinely sorry, women.
Yes.
It's just, we can't control it. It just happens.
Yep, exactly. But no, I mean, men absolutely can benefit from this. Now, I will say, if we're not using it for weight loss, if we're not using it for insulin sensitivity, I certainly would not promote just giving yourself a GLP injection just because it's out there and you have access to it. There certainly needs to be some things from a biomarker standpoint that these medications are going to help turn the tide on. Otherwise, again, you're setting yourself up for a bad outcome.
Yeah, so we need to shine light on this area a little bit because we have the world of TikTok and YouTube and all those things where you have experts getting on there, and we just don't know if we're getting correct information or not. True. So there is a term that's going around right now, which is Ozempic penis. Which you get the two sides of this. So there's the negative and then there's the positive. Okay. So you have right now what's going around is that it enhances your area, which again, you could correct me if I'm wrong on this, but I'm going to say that as the body shrinks, you probably feel like, things are looking better. So that's probably but I don't think it's actually making anything.
It does not, to my knowledge, at least, from a literature perspective, do anything to increase the size or length of the penis.
Okay,
you're exactly right.
We'll just clear that up right now.
Exactly. Now, you're right in that it does help as you lose adipose tissue, which is the fat that you can pinch. When you lose that, things are going to look, to your perspective, a little better than what it did, 6 months, a year ago. But it is not by any stretch of the imagination.
However, if you're using that for that reason, which is considered a wrong reason, let's say that, absolutely. Then you could get some of the negative side, which is erectile dysfunction, things like that kind of goes along with improper use.
Correct. And I will say that, from just, again, literature perspectives and different studies that are out there, erectile dysfunction is a vascular issue, right? It is, we can develop, because of bad habits and, other things, but atherosclerosis or hardening of those vessels anywhere, right? We worry about it in coronary artery disease, which can lead to things like plaque formation, which will lead to then things like heart attacks and things like this. As a provider, when I hear men coming in saying like, hey, I'm having issues getting an erection, or I'm having issues like maintaining an erection, to me, that's a red flag, because the vessels of the penis, or the blood flow to the penis, are larger vessels, larger arteries than that in coronary artery system. So that can be sort of a red flag for me to think, oh my gosh, maybe we need to get a coronary calcium score. Maybe we need to do some, angiographies to look at vascular health, to make sure that the atherosclerosis that could potentially be happening in the penis is not happening in other vital organs. So, no, it's not going to help increase your penis length, but it may, those sorts of things, if you talk to your healthcare provider about it and be honest about that, it might potentially save your life. I don't know,
Yeah, that was an interesting way. I haven't heard it put that way, because you kind of hear it as it's the medicine's fault,
right?
But the way you're kind of saying is, well, the medicine might be the thing that's pointing it out. Correct. Actually, exactly.
Because as you lose weight, as you kind of move through that and evolve through that, you're going to feel better. But the damage that can be done from all the bad decisions leading up to why you got on the medicine to begin with can maybe come to light, because you're moving a little bit more, you're exercising a little bit more, and you just realize, man, I just don't have the stamina that I did 5 years ago. And it, might be something worth talking to somebody about, so that we can kind of investigate that a little bit further.
Right. So we already kind of talked about nutrition and exercise a little bit, but when you have a client come in and they get started on GLP, what's kind of your recommended process outside of just getting the injections? What are some of those changes that need to be made?
Yeah. So, we kind of touched on it a little bit, but I think Mediterranean diet is about the best diet that I can prescribe. And I hate the word diet, because diets are fads, right? Yeah. But lifestyle, right? So that is the lifestyle that I typically tell folks to sort of lean on the most. And now, granted, I know we live in the Midwest, and you can throw a rock and hit a cattle farm everywhere around us. And so, I typically say you can have red meat along with that, as long as it is, grass-fed, grass-finished. So knowing your local butcher, knowing friends and family that maybe raise cattle and sort of access your meat, your beef through that, because what we know about these cattle that are kind of raised in feedlots, et cetera, they are pumped full of steroids. They're pumped full of antibiotics. They are making these animals grow so quickly, exponentially quicker, because they want to put them into the freezers at our other local stores. So quality has a big part in the types of food that you eat. Think about it from our generation, right? So, used to, we'd buy bread when I was a kid. In a week, what would you find on it? I don't know the last time I found mold on a loaf of bread. Yeah. And we've had loaves that kind of got lost in the back of the pantry.
Scary,
and you're like, what? And there's no mold.
There's no mold on it. Yeah. when my wife does sourdough or something, like she makes it and it gets lost in the back, it's like something's growing.
Yeah, exactly. It's a science experiment.
Whole different,
you can
organism.
Commit it to, your kid's science fair,
Yeah.
But it's the truth. Quality of food and how you prepare your food goes a long way in terms of fixing things like gut health, fixing things like inflammation. It's the processed, the fortified, the enriched foods that will live in the pantry for months and months and months that we know sort of causes some mitochondrial dysfunction, some oxidative stress. And that's the things that, then promote the chronic issues that we're seeing sort of, later in life.
Yeah. Oh, and I have, friends and family who they're taking some type of GLP for the correct reasons.
Yeah.
And one of the things they talk about is, if they do their injection and then they have, something greasy like taco beef or something in their tacos, the next day they're usually just kind of feel
crappy,
crummy and stuff like that. Or if they, store-bought steak or something like that, next day it's usually, so they're more aware of that now. So they're like, oh, I'm doing my injection, I need to eat this.
Yeah. It does. It kind of helps promote
a good thing.
Yeah, it helps promote those good decisions.
Yeah, yeah. And then what about exercise?
Oh gosh,
What do you kind of recommend for that?
So, I mean, the two big things I think that probably people can benefit from the most, and keep in mind, this is not everybody run out and go join the gym and start clanging and banging. You know what I mean? But even a little bit of resistance training, just enough to put some stress and strain on these long tendons that are associated with long bones. We see women, especially as they kind of go through menopause or perimenopause, the benefits of resistance training for osteoporosis and osteopenia go far above anything that they can get from a pharmaceutical standpoint, an injection and infusion and things like this, to help promote bone health and bone maintenance. So things like resistance training, bands that you can buy, online or wherever. HIIT training is the other thing that certainly I think provides a great deal of benefit, just from not only from a cardiovascular standpoint, but also from just muscle maintenance, because the term is, or sort of the saying is, muscle is medicine. And that goes a long way for both insulin resistance, for inflammation, for, gut health, these sorts of things. But the more lean muscle that you have as we age, the healthier, the sort of more able you are to sort of move around. Because, the statistic is this: if you're over the age of 60, and you fall and break a hip, 1 in 3 of those people will die in less than a year.
It's crazy.
Yeah. So, and that's a very well.
And we're talking 2020, almost 2026.
2026.
And we're still dealing with, over the age of 60. So you're talking, 65.
Yeah, absolutely. We saw that all the time. I think the metric that people use for understanding people's sort of health and longevity is, can you go up and down a flight of stairs without, using the handrail? That's a very well-known, statistic as well. Hanging from a bar, how long can you just free hang from a bar? That grip strength is a huge tell for how healthy you are pretty much across the board, because those are long muscle fibers and they're in the periphery, right? So as you begin to age, as you begin to decline, you're going to lose this first. So if you can't, hang from a bar for a minute, 2 minutes, things like this, that's probably a good eye opener that maybe you've got to do some things a little bit differently.
Yeah. And everything that you're talking about, I want to clarify, it can all be done at home.
Oh, every bit of it.
You don't have to have the gym membership,
no,
or anything like that. This is,
yeah,
because I know a lot of people, especially when they're starting this journey that have lived most of their lives overweight, that is a scary room to walk into.
Terrifying.
So this is an option that you could start here.
Yep.
This begins at your house.
Right.
And as you build on that confidence, then you can go out into and get into the gym and things like that. But all of that you just mentioned can be done at home.
Yeah. Body weight exercises are amazing. They really begin the process. They begin the evolution of things in terms of just getting the metabolism going.
And what I kind of told clients whenever I was personal training was like, we're going to start here. And I need 1 day a week where you're doing some type of exercise, whether it's HIIT or, body weight training or anything that you're mentioning. But all the other days, I just want you to go for a walk.
Yeah.
And it just created that routine and that habit of this is the time each day that I'm going to get my exercise in, even though I told them don't really call it a workout because then you start to associate it with I have to work.
Yeah.
Make it a part of your daily life. And then once you do that, you're like, I've walked every day this week and I did this one workout.
Yeah.
So then I can work out, walk, and then throw another workout in.
Exactly. Yeah.
And it's never recommended to do a HIIT workout every single day of the week. You don't want a high intensity workout. Yeah. So take those times to walk and really, and eventually it'll turn into a run and things like that.
Sure.
But really fall in love with that side of it. And then the gym's going to be nothing.
Yeah.
And you're going to get in there and you're going to start banging and clanging weights and everything, which is important as well.
Yeah.
To make sure you're building the muscle.
Exactly.
I also want to clarify that the muscle that you've built at a young age, that foundation is good, but it doesn't stick around. You can't just live off of that.
No. You've got to
keep going.
You've got to maintain at least, and and it's harder, obviously, and we'll talk more about this with peptides, like the typical peptide that everybody's sort of probably interested in. But as, we age, it's harder for everyone to gain muscle because of some lack of ability to sort of do so. So work on it early and then be able to then maintain that muscle mass, lean muscle mass, throughout that course so that when you age, you've got the ability to kind of, again, maintain the same sort of routine that you at least started with.
Yeah. So kind of highlighting there, a maintainable routine is the goal here, not something that, the running marathons is great and lifting, doing the bodybuilding stuff and powerlifting is great, but it's not a maintainable thing. I say that as a runner.
Yeah, you're right.
It's not something we can maintain. So make sure you have a good foundation that's maintainable.
Absolutely.
For the rest of your life.
100% agree.
So let's kind of dive into the HRT. So hormone replacement therapy.
Yeah.
You mentioned that you are a lab guy. You really focus on their labs before you start them on anything.
Yeah.
So I've heard this from a lot of friends, a lot of family. Why are so many women told their labs are normal when symptoms and everything else is telling them that this isn't normal?
So I guess
also I'll clarify real quick that a lot of these women are going to hospitals.
Yeah. And
general doctors.
And I will say this, and this is, myself included in this, is that when we were taught in school, hormone replacement therapy is bad. Like, you will cause cancer. That's the message, or that's the, lecture that we got when we were in school. And they were basing this off of that 2005 study, the Women's Health Initiative, which thankfully they just removed that black box warning for HRT and cancer risks. That was here in the last, 2 to 3 months. Thank God. But basically what that study promoted was a huge injustice for generations of women, and denied them hormones that they need, hormones that are beneficial beyond just the symptoms associated with menopause. These are hormones that help promote bone maintenance and bone regrowth, preventing osteoporosis and osteopenia. These are things that help promote cardiovascular health and vascular compliance. These are things that help promote neurovascular disease prevention. So generations of women have been denied access to hormones because that was the message that was taught, right? So when you women, not you women, but when you or women go to their primary care provider or go to, someone to say, hey, listen, I'm having XYZ symptoms, I think it's, my hormones. Well, without sort of going into the deep dive and going and seeking out the research and seeking out the evidence, you're taught that hormones are bad. So everyone has just said, no. Mm-hmm. And then things began to become, brought to light, and people kind of went to conferences and heard different data, different research. And now they're seeing the benefits of hormones. And then you have one provider in a town that is the hormone doctor, or you now have, people are driving all over the place who are getting their hormones other places, and it's changing their lives. Like, it's changing their lives.
Now, what do you think as far as with hormone replacement therapy? Are we over-prescribing it to younger women?
Yeah.
I mean, I'm talking like even early 20s. Is it something that they need, or?
And that's where the labs come in.
Yeah.
Right. So not only do I look at labs and look at these values and kind of base decisions off of that, but I do think symptoms are a key driver for where you need to go as far as looking for these things. So is it your thyroid? Is it the fact that you're in perimenopause? I mean, women as young as 30 can have hormone fluctuations that cause them to have symptoms that very much so mimic, perimenopause. And so cycling through different hormones to sort of help them, move through this safely and, give them the opportunity to kind of feel better as they go through this, because that's a natural process. Menopause is a natural process. Like, that's going to happen to all women, but they don't have to suffer through that like their mothers did or their grandmothers did. They can now ask for, with confidence, that they are having these symptoms and that, they should be given at least the ability to sort of make those informed decisions with their provider to say whether or not that they want to have hormones prescribed to them.
Yeah. So, premenopausal, what about post?
Same. So if we can, the literature shows that if we can get hormones replaced to a woman that has been amenorrheic or has not had a period within a 10-year time span, we can kind of reverse the clock a little bit about osteoporosis, cardiovascular disease, coronary artery disease, these sorts of things. We can see bone regrowth. We can see benefits from the symptoms associated with this: hot flashes, poor sleep. I think I read the other day that the number one symptom of women who come in who are, perimenopausal, menopausal, whatever, is that I just don't feel like myself. Right. And so, that alone should be a key to sort of like spark the thought process to be like, maybe we should look into hormones, and maybe we should, potentially give them back the things that they're deficient in and support them through that. Now, granted, and we know this, but hormones do not cause cancer. That is a known fact now, and it has been a known fact for a very, very long time. It's just not in that mainstay, teaching that most of us have.
We have so many things that, I mean, this can really go into a giant argument of, I mean, we're blaming hormone therapy for cancer, but I mean, look at what's in our food that we're eating daily and what we're drinking and in our environment. And I mean, you can't just pinpoint one thing and be like, that causes cancer.
No, exactly. It's a multifactorial thing. I mean, sitting is the new smoking, right? You can do more damage to yourself by having a stagnant lifestyle than you can even smoking on a regular basis.
I think it is like majority, I can't remember the exact percentage of Americans, but a large percent of Americans are sitting almost 8 to 10 hours a day.
I mean, we have to move. You're right. I mean, blaming a disease process on one thing is sort of asinine to me, because it has to be a multifactorial thing that sort of begins the pathway down that awful, awful road. But it's not just one thing that sort of causes this. It's one thing stacked upon another thing that's stacked upon another thing. And so, blaming cancer on hormone replacement therapy is just, it's bad science. It was bad science. And unfortunately it got to, everybody's sort of ear holes. And then that was sort of the thing that we did.
But now it looks like we're going the other direction.
We're going the other direction. And I'm thankful for that. I truly, truly am.
So let's get into TRT now. So testosterone replacement therapy. Actually, let me back up just a little bit. So with the hormone replacement therapy, is that, again, kind of like the GLP, is that something that once they start, they have to continue? Or can they gradually come off of that as well?
Most of the time, and there's no evidence that says that it's detrimental to stay on those things long term. I mean, I've known people in their 90s who are taking, estrogen and who are taking, testosterone, women. And there's no detriment to staying on these hormones as long as you are, again, in a relationship with your primary care provider or whomever is prescribing these things, and you're doing those routine health checks throughout the entire course to make sure that, we're doing these things safely and there's not something else that is impeding or would be impeding what we're trying to achieve with hormone replacement therapy.
So this first question with testosterone also works with the hormone replacement as well. It kind of go both ways. So we'll try to answer both of them. But if you're doing TRT, can it permanently shut down a man's natural testosterone production?
Yeah. So and we'll talk more about it with peptides, but for hormone replacement therapy, there is a biofeedback loop, right? So, increased testosterone tells the brain that I've got plenty of testosterone. And if that's an exogenous cause for the increased testosterone, in other words, you're giving yourself a shot or using a cream or a topical medications or a gel or things like this, it's going to tell the brain, hey, I've got plenty, so I don't need any more, stimulatory factors, right? So yes, it will shut down your ability to make your own testosterone. It will also shut down your ability to make sperm, right? So the FSH goes down, the LH goes down, and then that kind of shuts those things off. So it is a something that you have to have a conversation with your primary care provider about, because if you're deficient in it, do you need it? Absolutely.
Yeah,
absolutely. But if you are still in that process of family planning, you have to know that there's going to be some risks associated with that. And hopefully your provider knows how to maintain or at least continue to stimulate yourself to be able to make sperm or to be able to make testosterone. You can go on cycles of these things. You can use other SERM type medications to help stimulate your testicles to make sperm and to make your own testosterone. But yeah, it will. It'll completely shut those things down. Now, what happens when you get off of it, right?
Right.
Basically, what happens is the same thing happens when you go on it. The brain,
flips the switch,
it flips the switch. So, and I've seen it time and time again. most of the time men will go back to what they were producing before, maybe a little less, but that biofeedback loop kicks back in and your pituitary tells your body to start producing the testosterone, starts producing sperm.
So basically, to men out there, if you are trying to get ripped to find the wife to have kids with, don't take the needle out of Joe Bro's car that he's handing out to you of testosterone.
Yeah, you need to be very, very cautious and need to be very, very careful. And absolutely make sure that you are doing this under the guidance of somebody that knows what they're doing and someone that can kind of help you through the process as far as, making sure that you are doing it safely.
Now, as far as fertility goes and all of that, on the men's side of things, if they stop, and that switch kind of flips, then, like sperm. You said, it might be lower than what it was before, but
sperm production will
there is a potential chance for you to be able to go back into that, and
that's the point if you wanted to. Yeah, and that's and that's the point of the cycles too. Is that you maybe come off of the testosterone for a little bit and use something like HCG. HCG has been around forever, right? And we can sort of give shots of HCG, which will not only help you produce your own natural testosterone, not to the level that you're probably wanting it to be at, but it will also stimulate testicles to start producing sperm again.
So after I mentioned that, I was like, also, I want to make sure that there aren't guys out there that are using this for kind of a
sterility,
vasectomy,
chemical castration.
Yeah. It doesn't work like that. Once you stop, you could still be plenty fertile out there.
And
so,
gosh, I've known plenty of men who've been on testosterone replacement therapy that have successfully conceived. So it's not that. It is a cumulative effect. In other words, however long you've been on it will affect it to that degree more.
So we have, it seems like to me that we have younger men, because that's what I know, but also women that are struggling with, erectile dysfunction earlier.
Yeah.
And again, what I feel like and maybe it's just me, but some women are struggling with hormone and stuff.
Yeah.
And everything earlier and earlier. Is that a product of the foods we're eating, things like that? It just seems like we're having to start these things earlier and earlier. And companies like Hims and stuff like that are definitely getting rich off of this. But I mean, I know people that are way younger than me that are like, I'm taking Blue Chew and Hims and all this stuff. And I'm like, why?
Yeah. Why? And it again goes back to, very lab driven, very lab heavy. I think, the range for men and their testosterone is like 200 to 1,000. That's a big window to be normal, right? It's not optimized, but it's normal, right? And so again, symptoms are typically what drive guys to come see me. And I always talk about, for me on TRT personally, it was the fatigue. It was the gas left in the tank at the end of the day. If I was moving, I was typically fine. But man, the second I sat down, I was not getting up. And a lot of times men will hear, hey, that's just part of aging. That's like the go-to. Yeah.
This year I've had heel issues in both my feet, so I haven't been able to run as much. And everything I get in return is, just getting older. I'm like, no, I'm not going to accept that.
No, and you shouldn't accept it. I mean, you shouldn't accept it because, as we age, right, our ability to naturally sort of make these things, I think the statistic is per decade of life, you lose about 10% of your testosterone, men. Mm-hmm. And so there's no reason why, as a man, that you should have to, just exist, right? There is the ability to not only exist, but exist like very vital, exist very, ability to roll around on the floor with your grandkids or your kids, right? And so that's not an acceptable answer, in my opinion. Yeah. In my opinion. And so seeking out those types of answers and looking at, where you are on that timeline of laboratory values to help yourself and be knowledgeable about these things enough that you can have a civilized conversation with a provider and just say, listen, I just think a little help would be great. Yeah.
I agree. I don't know. I was like, no, I can't accept that. There's gotta be something else wrong. It turned out, which is like the runner's excuse, but I promise you that this is real. This actually, because I really looked into it and dove deep, but it turned out to be my shoes because I switched. I switched brand. Now you could go from, old shoe to new shoe and it'd be the same brand and typically be okay. But I was like, I want to try something a little different. And it turns out it just does not work right for my foot. Yeah. So I was like, I'm not going to accept that I'm old because I can't tell you how many times I've been out on a run and some 80-year-old dude has been running right next to me.
Exactly. No.
So like, I know if he can do it, then I can do it.
I should be able to do it. Right?
Obviously, there's other underlying things that can happen and stuff like that can, contribute to you not being able to do that. But just growing old, I don't think is a good enough excuse anymore.
No, I don't think so. Not with our ability to sort of seek out information and kind of find those truths that go along with, aging well and being, very having vitality as you age. Yeah. There is plenty of options, plenty of availability for people to seek out those that will help them through that process.
So let's get into the peptide therapy side. We'll start off with which peptide. You kind of mentioned a little bit over there. You got 300-some thousand different peptides. Right. And then how many of them?
I think 1,000 is what we know about. Yeah. Right. That we can sort of like say this peptide does this and this peptide does this. And then even smaller, I think from a, prescribing and or FDA approved or on the radar of the FDA, I think there's probably 80 or so. 100 maybe. I don't know. And that could be probably.
So that's what which ones of them do we know that have the strong human clinical data that we can say for sure, if any right now, that we can say for sure does this without, much. I would say with anything, there's going to be some type of side effect or something like that that could happen. Yeah. But
there are way more animal data that goes along with these peptides. Because a lot of times these peptides are just, newly discovered. And I think physicians in Russia and Ukraine are kind of the people that began looking into these types of peptides and their benefit for health maintenance, for longevity, for immune responses, for recovery, for, you name it. Libido, for hormone maintenance. I mean, the list goes on and on and on. So, the animal data is kind of where we start, right? And then because sometimes these peptides in the way that research grants and research availability sort of is funded, we in the United States don't have a lot of access for researchers to kind of be able to deep dive into this and do the research for humans because we don't know, a lot of things about it. So the research is coming from elsewhere, and then we're picking up on these things and then, having access to these things to be able to use them and in ways that, again, and I'll talk about some case studies that I've heard about, or at least people have talked about on different podcasts that are experts, true experts in their field that, is insane. Like, it's insane. So there is not a robust human model studies for a lot of these peptides, but there's a lot of extrapolation that happens from animal models that we can sort of assume things like this will happen in human models. And that doesn't go for all peptides. I mean, it goes for, I would say, not even the majority, the minority of these peptides that we know about, that we hear about. BPC 157 has a robust human data, a lot of literature that sort of is published out there. So you can go out and seek those things out. CJC 1295 absolutely has some robust human data available.
So you just mentioned that one. I'm glad you did, because I was sitting here. It's one of my questions. I'm like, man, I hope I say this correctly. So I'll just staying with that one.
Okay.
The CJC 1295.
Yep. Safe,
or do they risk activating cancer pathways?
Good question. So I would say most of these peptides are very, very safe. When you start diving into these growth hormone optimization type peptides, the CJC 1295, 1295, the tesamorelins, the ipamorelins, the samorelins, those peptides, certainly probably have the greatest risk for side effects and for bad outcomes. So, but from a normal day-to-day, men like you and I, women like our wives or friends and family members, for the most part, they're very, very safe. Very, very safe. There have been some with these growth hormone optimization type peptides. There's been some cases where there's been some anaphylaxis, or for instance, people that are, again, getting it from their gym bro, are administering this at a level that is, super physiologic, and they are causing some damage downstream. Because keep in mind, what are these things? These are short chain amino acids that are signaling a pathway for your body to produce the desired response. So, for instance, when we were kids, right? Think about going outside, playing, rolling your ankle, or falling and hurting your wrist. What happened the next day? You were back up doing the exact
It might be
thing.
a little ache, little pain,
ache,
but
whatever. But you were going on about your business. What is that? That's growth hormone. It's growth hormone. So we make growth hormone day-to-day basis, but just like anything else, over time, you just stop producing it at a level that is considered therapeutic. If I rolled my ankle when I walked out of here and off the curb, dude, it's going to take me 2 freaking weeks before I can ever get back and do the things that I'm doing now from an exercise perspective. So, we hear anecdotal evidence that athletes, that other people in that space are using them, and things are happening that are just really kind of superhuman.
Yeah, and that's what's really kind of, I think, professional athletes have brought peptide therapy kind of into the light a little bit, because it's being used more and more as far as recovery. And you've mentioned a few times inflammation.
Yep.
I don't think people realize how much inflammation impacts your body, and how much we as kind of normal people tend to carry
Oh,
within our body.
Part of the biomarkers that we check for a high sensitivity CRP, right? And what that gives us an idea of is just general inflammation. Sometimes these things are just literally off the charts. Now, it's not specific that it's inflammation for this. It's just how much inflammation do I...
There's somewhere in the body. There's something.
Inflammatory pathways that cause or sort of give those types of responses from a biomarker standpoint. So, if we can reduce inflammation, and not all inflammation is bad, don't get me wrong, right? But if we can reduce just general inflammation and get that down to a manageable type level, then, that gives the body opportunity to do what it's supposed to do and heal itself, which is what we're trying to do, especially even when we're trying to, or introducing peptides into the mix.
Right. So I think we've answered this a few times, and I feel that this is 100% true, and I'm actually looking forward to it. And you and I have had conversations outside of this about it as well. But as far as, peptides with the GLP and everything included with that, they're the future. Are they? I mean, do you feel they're the future of weight loss, anti-aging, recovery, all of these things? And I think they are too. And I'm really excited about that because this is the step into what I think American culture should have been for a long time, which is preventative.
Right. And I agree 100%. I think as long as the powers that be stays out of the way of the research, the science, right, where we can get human data, where we can get evidence that shows that, these things help promote your body's ability to heal itself, let alone, or going away from going and seeing somebody and saying, I hurt my ankle. Oh, here's your prescription for 800 milligram ibuprofen or some other anti-inflammatory medications, right? This drives your body's ability to sort of heal itself. And that's something that once we kind of get that key in the lock and unlock that, I think the sky's the limit.
Yeah.
Because then you start combining these things, using peptide A with peptide B, which, for instance, let's just say a GLP. What's one of the side effects of using GLP and kind of doing it very, very quickly is sarcopenia, muscle loss, right? So using GLP with something like a ipamorelin or tesamorelin or growth hormone stimulating factor, CJC 1295, to help promote lean muscle mass protection so that you're not losing lean muscle while you're also losing weight.
Which is a big thing.
Yeah.
I mean, that's huge because that's one of the main complaints, but also worries from a trainer's standpoint or somebody kind of outside looking in who has somewhat, I'm kind of talking about myself right now.
Yeah.
I don't have all the information here, but I have somewhat of an idea of what's going on. And so whenever I see it, I'm like, man, are you losing just the fat, the bad stuff? Or are you losing all the good stuff too?
Right. And
with that. And so if we can help save that and know that would be a huge breakout for GLP.
Yeah, right. And, you can stack these things and you do have to be careful because you don't want to activate the same pathway over and over and over because that's, again, leading to things that could potentially be bad down the road. And I do think that most of these peptides, as safe as they are, they're also probably something that you don't want to be on for long periods of time because, you don't want that signaling pathway get used to, the exogenous bump, so to speak. And you want to be able to promote your ability to kind of also do these things on your own. So a lot of times these things are always cycled, right? We'll do them for, let's just say 3 months, 5 days on, 2 days off. during that 3-month time. And I think, that's a lot of times the protocol that we typically see, or that we typically kind of promote when people are kind of on these things.
Yeah. Yeah. Which that makes sense. So the peptides itself, they're not the long-term thing. They're kind of again, you mentioned GLP as a tool.
Right.
They're essentially a tool or a Kickstarter or a jump starter, I guess, if you want to
truly
use it in that term as well.
Like, a BPC 157, right? So, I mean, that's one I think that, we've all heard of on social media or somewhere in that space, right? So BPC 157, body protection compound 157, we make this, it's from our gut, right? So, when you have an injury, when you have muscle injuries, tendon injuries, tendinitis, things like this, when you introduce body protection compound into that protocol to sort of help you promote healing, you're just promoting an increased signaling effect of that peptide that you are producing to help promote that healing process. Once the healing is done,
it's done. You don't need it.
You don't need it.
Yeah.
You can come off of it. But, we've seen and heard of people who are using it in that regard for Achilles injuries, for shoulder injuries. A friend of mine tore his rotator cuff. I don't know, 3 to 4 different tendons associated with the rotator cuff. Put him on BPC 157. And I think the doctors that he was seeing, the orthopedic surgeons that he was seeing after he got his repair was like, what are you doing? Like, you are moving through these recoveries quicker than to be expected.
Yeah.
What's going on?
Yeah. Well, and it's looking back, we saw it was a just devastating when Kobe went down with the Achilles.
Yeah.
And then years later, you see Aaron Rodgers go down, and you're like, oh, well, I was, because I was a fan, but you're like, oh no, what's going to happen? And then all of a sudden, he goes to the same doctor that Kobe went to.
Yep.
He goes there. He's doing better, quicker. Now we have current players this year that have, I think, Tatum tore his, and now he's already dunking again.
I know.
So there's we know that there's something else at play here that just wasn't around.
And again,
just a few years ago, even.
It's, that's part of the pie, right? So I'm sure they were using some things like PRP or other types of, promoting that healing effect. But we know, and it's well documented, that BPC was part of that.
Yeah.
And the fact that, just think about it like this, right? And this is maybe a bad way for me to think about it, but, why does the powers that be sort of limit our access to these things? Because they have been put on and taken off the prescribability list from an FDA standpoint. But think about, from a orthopedic surgeon standpoint, and the surgeons that I know, they're surgeons. That's what they're trained to do. But if you can heal these things without steel, without putting, material in a joint that is foreign to the human body, and reduce, for instance, infection risks and things like this, I think most people who are in that sort of frame of mind would be a proponent of that. Right. But they're, again, kind of hemmed up a little bit in terms of what they can do, because the powers that be are what's kind of driving their ability to prescribe or treat. We
could go down a very dark rabbit hole for that one, because then you start to, you start to wonder, well, as we do this, it leads to a foreign object in the body that the body doesn't like. Yep. So then you have to come back and we have to do that. Or it's an infection. Now come back in here. Here's some antibiotics for your infection.
Exactly.
Pay us this much. Exactly. And so it's a recurring thing. Exactly. Whereas with peptides or something like that, where we can find a permanent solution for it, it's like, well,
why not?
Well, Well, the why not is because you don't come back.
Exactly. Well,
and we need you to keep coming back.
True. Yeah. Good point. Yeah. You're exactly.
But like I said, you could go down a very dark hole with that. So as far as peptides go, GLP-1s, HRT, TRT, all of that, when we're talking about symptoms like POTS,
okay,
are any of these therapies capable of helping that or relieving some of the issue? Or
yeah. I think that, each individual patient needs to keep an open mind to explore options that are available to them. Have I seen and have I kind of read some evidence where microdosing GLPs or microdosing, other peptides to sort of help bring, inflammatory responses down and to help promote, those signaling pathways that things like POTS are sort of triggering? Can they be helpful? Of course. Mm-hmm. But is that the right answer for everyone with POTS? No. So, one of the things that certainly GLPs can probably be a detriment for that is that a lot of things that drive POTS has to do with hydration. Mm-hmm. So as you are on a GLP and you're not eating correctly or not eating substantially enough where you're having enough protein, where you're drinking plenty of water and you're getting all the right electrolytes, that could probably make those symptoms worse, right? So you want to make sure that, again, you're working with your healthcare provider, that you're listening to your body and you're not just pushing through symptoms because you think this is the quote magic bullet, right?
Right.
So you want to be able to understand that as some people may benefit from this, other people may not. And so you don't have to sort of push through these things just because you heard online or whatever that doing this maybe will help you get better. But, keep an open mind and have a conversation with somebody that potentially knows what you're doing and be able to kind of make that decision or help you walk through to make that decision for yourself.
And again, it really shines a light on when you're talking to your healthcare provider, talk about everything. Yeah. Like to be completely open with them about everything, because it's the only way that it can truly get figured out is if you're just put it all on the table. Yeah. And at times be a little bit, here is everything. Here's what I want to do. Because I feel like sometimes with our health care providers, I see everything, try this. It's, no. Especially with hormone therapy. No, I want this test done. Yep. Sometimes we have to say what we want in order to kind of get to that next step.
And the other option, there are plenty of avenues out there that you can create an account and get these, 25 biomarkers drawn yourself, right? Mm-hmm. And then take that information with you to your healthcare provider and just say, help me navigate through this. Because even though that the healthcare provider may not be ordering, XYZ test, 99% of them will know what to do when they receive the result that potentially you bring to them and be like
that.
Oh,
put it in your own hands a little bit.
Exactly. Yeah. So, don't be afraid to kind of take the onus on yourself and be your own best advocate, I think. Now, to an extent, of course, obviously, and making sure that you are coming in with a frame of mind that, you're not the demanding patient that sort of is saying, hey, listen, I want this, I need this is what I want.
Yeah, there's a
fine line.
Yeah, fine line. There's a kosher way of doing it.
But being your own advocate, being your the person that is taking stock into your own healthcare, I think is so beneficial. And I love it when patients do that with me. I love it when patients say, listen, I've had these and these symptoms. And I got these labs, like what do these things mean? And man, I'll go through them line by line. I love it.
Yeah.
I love it. And again, just being your own advocate and certainly taking stock into your own healthcare, I think speaks a lot to, the patient's desire to feel better.
Right.
You know what I mean?
Yeah, definitely. So we kind of talked about POTS and other things, but I want to talk about something that seems to be growing. I'm not sure. I'm not sure why we're blaming it on the tick, but yeah, it could be some other underlying things. But has there been any studies or anything with peptides and things like that as far as alpha-gal goes? And
I don't know specifically if there's been any studies looking at peptides and alpha-gal. I do know, and I agree with you. I mean, I've lived in this area my entire life. I've probably pulled 100,000 plus ticks off of myself, right? So there is this growing immune response to that specific sugar that is released by the tick whenever it bites you. It gets into your bloodstream. You create an antibody for that. And then that sugar is also found in mammalian meat, right? Mm-hmm. So when you eat mammalian meat, red meat,
it has the antibody.
You attack your GI tract, for lack of a better term, which can cause, again, a whole host of symptoms, to things like diarrhea to anaphylactic shock. I think there was the first person that, since we've known about alpha-gal, that just recently died because of an anaphylactic reaction to red meat after eating red meat.
Yeah.
And the problem is that it's a delayed response. So it's not going to happen like this. You're going to go and, to a grill or to a outdoor party, and then you're going to have a steak or a pork steak or something like this, and then you're going to be driving home, and that's when it could potentially happen. And there's no rhyme or reason.
No, we had, obviously I won't mention his name, but we had a kid on our cross country team. He had a speaker had came to the school and handed out some Mexican candy thing, and it had something in it that triggered his alpha-gal, and he was out on a run and came back and was just puffy and red and everything, and had to call mom and stuff, and it was like he came back, we were like, whoa. I mean, he looked like a different person.
Sure. Yeah.
With it. So it is scary, but I know that there has to be, I don't know if it's something that we're putting in our body from food that's also counteracting with the tick bite or something, or if but it's interesting.
I sort of have a theory, and this is truly just my theory, right? Is that because of the way that we eat, we do a lot of damage to the inner lining of our gut, to our bowels, right? Our small intestine, our large intestine. There are these little finger-like projections that sort of live in there, right? And those things are called microvilli. When you injure those microvilli, you give the things that are traveling through your bowel access to, a couple cell layers of thickness between the inside of your bowel to the outside of your bowel. 80% of our immunity lives right here on the outside of our bowel. So if you have injured those microvilli, my theory is that immune response has now greater access to the things that are moving through your gut. And I think that potentially is what is causing these upticks in things like alpha-gal. Leaky gut is the definition of this thing, is the medical term for this. And that, again, I think is probably, and I know it's because of how we eat and how we don't take care of our guts.
So just, Mediterranean diet.
Just
eat a little bit better. So last question, then I know you might have a few things that you want to touch on as well. So I want to give you an opportunity to kind of go through your things, but we're running out of time here.
Okay.
We might have to do a part 2 on this, because I know we can keep going.
We haven't even really.
What's the biggest kind of misconception that people have across the board with each of the therapies we've talked about today?
I think that, as a population in general, there's a lot of information, period. What's real, what's science backed, what is just anecdotal.
Right.
And I think, from a provider standpoint, that trust that patients, put into me whenever they come see me to sort of talk about those things, I think a lot of trust has been lost in the healthcare community. Mm-hmm. And there are a lot of providers that truly do care. And there are a lot of providers that are not out there to sort of like make that buck. They're truly there to help patients navigate through these symptoms, through the course of what's going on. And I think that a lot of times where patients, lose that trust is that we don't listen, right?
Yeah.
We don't listen. We just are there to kind of like run the machine.
Yeah.
Right. And that I don't think is a product of bad providers. I think that's a product of, the system that is overworked and access is limited.
Right.
So, having that trust with your provider, I think, is key. And being able to kind of come in and talk to them about the things that are going on, and having that provider be able to listen to you and make, educated guesses, because it's practicing medicine, right? We're just kind of guessing. We're using things that we've learned and things that we've seen throughout the course of our practice to be able to make those decisions. But giving the ability to sort of have the patient make those decisions themselves, but giving them all of the information, not just what you think, right, is the right answer. In other words, here's the medicine. Let's try this. Let's try to like walk upstream a little bit and see if we can't figure out why people are jumping into the stream, as opposed to like trying to pluck people up out of the stream when it's kind of too late.
Right. Yeah. And I think that that's kind of the mindset that our healthcare has been in, because we haven't had these things to kind of lean on with it. So it's just always been kind of a, reactive type thing instead of more the preventative side of it. And now we can, with these, maybe it's media, maybe it's our own minds or whatever, but we're always looking for the bad. Or where's the part that, it can't all be good. I think, growing up, you always heard, too good to be true type of thing. But I think, like you said, we got science that backs a lot of this and things like that. As long as you're working with the right provider and everything, and they're managing it, again, not, getting some of this stuff out of the guy's, car at the parking lot gym or anything like that, but working with an actual healthcare provider. These are going to be huge for healthcare in America and around the world. And I'm really excited for it.
I am too. I think, again, this is a very promising side of medicine that we're just basically beginning to understand.
Yeah.
And as information kind of gets put out there, as information becomes more available, I think that allowing oneself to kind of take that onus, make those hard choices for good behaviors, good habits, I think those are the things that are going to be what moves the needle.
Yeah.
These things, peptides, other supplements and things like this, these are the things that begin the process, that begin our ability to kind of push ourselves to make those right choices. And you have to think of these things as tools. You can't think of them as the thing that is going to change your life.
Yeah, the magic.
Right. So
pill, injection,
exactly.
Whatever you want to call it.
Because again, once you begin that process and go down that road and have tools to kind of show some benefit and make some changes, it's easier to make good choices.
And I want, women and men alike to understand that there's, drop the stigma, I think for so long there was this, she's clearly on, Ozempic or whatever, but these things can, they're not the magic pill or injection, but they, as a tool, they can kickstart that process. And as long as you put in the work and everything, you can live a better and healthier life.
Yeah.
With them.
It's harder to make those decisions when you feel like garbage.
Yeah.
Right. So what these things are doing are helping you feel better so that you act better, I guess, is what I'm trying to say.
No, I think that's perfect description of it, because you're 100% right. I've worked with clients and for years, and is like pulling teeth to get them to come back. I mean, I'm sure you could talk to any personal trainer and they'll tell you the stories of how they were trying to market and stuff like that and get out there. And there's so many things just trying to get people back in there. And what it came down to is people felt uncomfortable.
Yeah, they felt uncomfortable.
And so if this can help you feel comfortable to start making the better decisions, to start eating better, start getting back into the gym eventually, you just start going for a walk or, whatever it is, then do it. Yeah. And don't let anybody's drama or whatever deter you away from living a better life.
100% agree.
So, but that was pretty much all the questions I had. If there's anything else that you kind of want to get into, I want to give you that opportunity to get into it. We could talk about this forever and ever, I'm sure.
Yeah. I don't know that I have anything else more to add. I mean, we've kind of scratched the surface. I would be totally interested in coming back for part 2. Yeah. Having people kind of drop some questions and comments and kind of see what their responses are about me coming back and doing this. But this avenue of medicine is going to be something that kind of changes some geography a little bit in terms of how we approach feeling better. And I think that, again, using these things as a tool to kind of help promote those things, I would never deny access of a patient to these things, with the exception of contraindications, why they shouldn't be on them. Would never deny them access to these things to help them promote themselves feeling better.
Right.
And I think that's the important part, is that, again, there's no, what I say, potion, injection, whatever that's going to outlive good choices. So just, making those good choices, but understand that you've got to like the person inside that you'll want to make those good choices for you.
Yeah, I agree. Yep. And I want to mention your clinic a little bit, and a little bit about how people can get in contact with you and get started with that as well.
We have, our clinic's name is Optimized Health and Integrative Medicine. We're on Facebook. We're on Instagram. Our phone number is 417-533-4355. Would be happy to kind of walk through these things with you based on, your own individual lab data. Also have a podcast, On Call, that's with Lebanon Now. And what I do there is sort of kind of like this, but I give little snippets of different things like atrial fibrillation, like alpha-gal, like celiac disease. Just kind of try to get robust information out there to the public so that, if they're having similar symptoms or if they're having issues like that, then it kind of gives them some awareness to be able to recognize that there is something going on and that there are, options for them. It's not something that they have to suffer through, so to speak.
Yeah, definitely. And of course we'll link everything down in the comments of the video and stuff like that when it's posted, so everybody can click on that and find your guys' Facebook and website from there. So Ryan, I really appreciate you coming on. We will definitely have to do a second one, but I love the idea. I'm going to kind of put it back out there in the media world to anybody who has any more questions about this or wants us to dive deeper on a subject. I'd love to hear about it. And we'll make sure we touch base on that the next time you're in.
Thanks.
I really appreciate you.
Gosh, thanks you. Appreciate it.